where you would be getting a patient perhaps like a new admission. So we will be evaluating everything. Okay. We're always going to hand hygiene. An assessment is something all of us will do at one point or another. You should be assessing your patients every shift because we document that. But when it's an admission, it's a longer assessment, and you're going to be looking at every teeny little nick and cranny just to make sure they don't have wounds, because part of the reason is if they come in with wounds from, let's say, from a long-term care facility and we don't find that at admission, later it's discovered while they're under our care, it falls under us and we get dinged for it. So let's say it's a stage 2, later becomes stage 3, now we have to report it to the state. So it looks really bad. And at the same time, we want to start providing treatment for that wound as quickly as necessary. So before you start your assessment, we always do a set of vitals. That's always the first thing you want to do, is do a set of vitals. Make sure your patient's not in any form of distress. If everything looks good and it's their baseline vitals, then you want to go ahead and go. Another thing you want to do is you want to assess them for pain, because we are going to be pressing in areas. We don't want the patient to be uncomfortable while we're doing this. Some of your patients may be uncomfortable, and if they are, then you would want to medicate first before you go ahead with your head-to-toe assessment, okay? So just like everything else, you're going to check your doctor's order, gather our supplies. I do need the wound, it's, you know, the little things there,
The measurement?
the measurement, yeah. That'd be a ding off of a check off. You gotta have everything ready. Okay. So what you would need is something to measure in case you do find a wound. You want to measure it then and there. You need your pen light and you need your stethoscope. Okay. So I do want to look at my patient to see if they're on any oxygen. Do they have any IVs? Because I want to see if all of those are patent. If they come in with a trach, you want to assess what kind of trach it is, and that you can do as you go through. So there's no wrong or right way to do this. As long as you cover all your systems, you're fine. Okay. So I'm going to go ahead and hand sanitize, and I'm going to glove, because we don't know if we're going to encounter any wounds or anything. It's always best to glove, and we don't know where this patient could be coming from home. There's times you find a lot of, they either have scabies. I've had people get admitted and they come in with infested in lice. So you want to glove first. So you want to, of course, identify your patient. This is Enrique Papi. Date of birth, have him verify, 6/16/66. Okay, so you've identified your patient. You want to find out for any allergies. Our patient here is allergic to iodine, and he has at fall risk bracelet. So you want to make sure you definitely want to put your head in low position. As far as head of bed, it just depends on what their situation may be. If it's like a COPD or they can't tolerate to be down, the only time you really have to put the head down is when you turn them to the side to check, to assess the back. Otherwise, you can do your entire assessment with a semi-Fowler's 30 degrees. It's okay. So the first thing I'm going to do is I'm going to start from the head. So as I'm assessing the head, I'm feeling for any lumps, bumps. I'm also assessing the hair for any the texture. Do they have any alopecia? Do they have any critters running around? Any lice, eggs, because you will discover that. As I'm up here, I want to look at behind the ears, because if there's someone who's on oxygen at home, sometimes the cannula can cause some breakdown in the back. So while I'm in the ears, I also want to inspect the inside. So I want to see if there's any redness, any kind of irritation, any pain. Also check the other one. What you do on one side, you do on the other. I'm going to feel for his sinuses here, and making sure that they're not congested or they're not swollen. No pain. I'm going to assess his pupils, open up his eyeball, check for perla. You also, you can check for anemia, you can check the inner canthus, but obviously not putting your entire nail in there. So you're going to check the inner canthus, especially if your patient came in for maybe some bleeding or something, you want to check that out. So as you keep going down, you want to assess the nose. So here, you want to look inside, look for any kind of redness, any deviation. You want to look inside the mouth. You're looking at the tongue, the oral mucosa. At this time, you want to find out if they wear any dentures. You also want to find out if they wear any glasses or any contacts, because especially if you're doing this assessment and they're going to surgery, if they have contacts, those need to be removed. We also want to find out as far as their dentation. Do they have a partial? Do they have a full? Or do they have any loose teeth? That's another important thing, because if they're going to surgery and they have loose teeth, that can become a problem during intubation. So we need to know all that. So as we come down, we want to feel here. We want to look at the side, see if they have any jugular venous distension, see if they're fluid overloaded. You want to also palpate carotids. Remember, carotids, you do one at a time. You don't want to do both because your patient will obstruct oxygen flow to the brain, so you'll pass that on you. Unless you don't like them. No, just kidding. Okay, so as you're coming down, always listen to lungs directly on the skin, okay? Because I know there's a practice, and you guys will constantly see it. Everybody, staff, doctors come in, and they actually listen above the gown. You want to always listen directly on the skin because you do get better adventitious sounds if they have some. Put it on. You're gonna do 8 breath sounds, 8 in the front, 10 in the back, like so. Avoiding areas with bones. See, this one I can really tell. You don't want to be directly on the bone. You want to be in between the areas, okay? Have them take a deep breath in, deep breath out. And then if it's a woman and you don't want to expose her, you can always just put your hand between the gown, as long as it's in the proper place, and have her take a deep breath in and out. You okay? Another thing I can do right now too, I can check for skin turgor. I can pinch the middle. While I have my stethoscope on, I can also check for my heart sounds, my aortic, pulmonic, herbs, tricuspid, and my mitral, which is here. And that's also considered your point of maximal impulse. That one you would want to listen for about 1 minute. So you look at your own, just to make sure that matches your pulse that you got on your pulse ox or your monitor. Okay. You also want to start assessing the skin here. You want to raise the arms, look under, make sure there's no breakdown or any growth of yeast. Since you're up here too, you can start checking strength, capillary refill on every finger. Okay. So have them push up, push down, squeeze, and it's always best to, when you do the squeeze, do both at the same time to see if they have any weakness on either side. Have them press my hands. Okay, good. Pull away, have them pull away, and see if they can extend too, if there's any issues with their extension. Out. Okay, so you keep coming down. I did want to tell the patient that I will be exposing certain areas too. So now I want to listen to the abdomen. So the very first thing, once you get to the abdomen, you want to look, listen, and feel. So we don't want to start pressing anything until you've auscultated, okay? It's always best to start with the right lower quadrant, because they say if you're not going to hear bowel sounds, you should always hear some in the right lower, and if you don't hear, very likely you're not going to get any on all 4. So listen. If you don't hear anything, you have to listen for 5 minutes to determine that this patient has absent bowel sounds. They can have hypoactive. That one you don't have to listen to the full 5. Only if you're going to document absent, you are indicating that you listened for 5 minutes to every quadrant. That would be like a 20-minute abdomen assessment. So be careful documenting that. So continue going down. Now, we're still here. I want to ask the patient, when was his last bowel movement? I want to see if they have any kind of constipation. At the same time, I'm also going to palpate, percuss. Okay. They're full of air. Okay, I'm coming down. Check the bladder. When was the last time you voided? And then as far as bowel movements, was your bowel movement normal? And when you voided, was there any blood, any pain of urination? So you're assessing the GI and the GU at the same time. You want to look around the labia area. Make sure that there's not any kind of yeast or things look normal down there. Oh, now let me come back here too. Let me do my radials before I continue. Radial, brachial, radial, brachial. Now while I'm here, I'm going to check my femoral. femoral. Also looking at the skin. We're going down. So our patient has an amputation. They also have wounds here, so we want to measure that. We want to check how the capillary refill here is, temperature. Have them raise their leg up. You can check for strength. Have them go down. Tell them to push on your hand like the pedal on a car. So check that strength. Here we can't do that, so we're just going to see if they're able to raise and bend their knee. And pulses. Check for the pulse in the back. Your dorsalis pedis. Okay. Let me make sure I don't forget anything. Okay, as far as the front section. Now you want to tell your patient that you're going to put their head down because you're going to turn them to the side. These mannequins are very heavy, so I may have to help you when you get there. And as you're going down, you're also checking the skin temperatures. Every single thing you're touching, keep in mind that you also want to check temperatures. With these mannequins, because they are heavy, best thing is to bend the knee and then you can turn it to the side. Okay. Alright, so now you're going to check the back. Take a deep breath in. Out. You're going to do this 10 times, okay? During demonstration, you don't have to do the full 10. Just tell me you're going to do 10. Because as you can tell, it's pretty takes long. So one of the biggest important things here is you're looking at any kind of dependent edema, and you're also checking for any kind of breakdown to the sacral area, because that's a high area for breakdown. Since our patient has wounds, we want to measure them too. The ones on the heel, you can grab right here and then this one. You want to measure and document. You want to notate all the characteristics of the wound. Have them come back with body intact. Head back on. This one's not good for demo because he's falling apart. And that's pretty much it, guys. So let's bring the bed back down. Give them their call light, position them for comfort. Put the head of the bed up. Because all of your patients should be at least a 30-degree angle. Bring them up. Ask them if they have any questions. And document all your findings, all your abnormals. Because this patient has wounds, you would want to call the doctor, let them know that they have wounds. And then you would just document your entire assessment. Just make sure I didn't forget anything. Nope, we got it all. Any questions? It says lengthy, huh? Very detailed.
The ones on the toes, how would you measure those? Like,
for those, you'd want to describe them.
Yeah.
You would still want to measure whatever you can possibly do. You know, some of them were really tiny.
Mm-hmm.
You just forget about those. You'd measure. Huh?
Oh, I'm sorry.
You'd want to measure, like, just like how many centimeters it is. So, like here, it's like 1 metric centimeter. Some of them, and of course with this one, what would we document for this ones?
Like what toe it is?
Unstageable. We would say unstageable. Yeah, and of course you would say what toe, like right, greater, big toe. You know, describing where they are on the toes and what they look like. If it's possible to measure, then of course you're going to measure. Tiny little ones you can't measure. You just describe.